Hi, it's Dr. Centeno, and today I'd like to talk about how Ben Greenfield, a biohacker, got scammed. And we're going to learn a lot about amniotic and cord stem cells. And I really hope that after watching this video, Ben will come clean with his viewers because I don't think he knows he got scammed. So Ben Greenfield is the guy who had adipose stem cells injected into his perfectly healthy penis to make it bigger. Little nutty, I agree. And he recently did a Facebook Live event where he said he was having amniotic and cord stem cells injected into his low back nerves. Now, Ben considers himself a biohacker, but in this case, he seems to be the one who got hacked by the acupuncture clinic he went to. As I'll show you, the whole event was largely a scam, from the idea that he was being injected with stem cells to the concept that these cells were anywhere near his low back nerves. And I think, like most patients, Ben really had no idea that what he was being told wasn't being done. So this is actually from the video. We see some sterile prep here. Now, regrettably, this procedure isn't being performed by a doctor. God knows why Ben allowed that. It's being performed by a nurse, and there's no sterile prep. This is not a dedicated procedure room. You don't see any imaging guidance, so these are going to be blind injections. Now, the nurse says, "Do you want to see your new friends?" And he claims that these are stem cells derived from amniotic and umbilical cord. And Ben says that this is a great way to get young stem cells into your body. The problem is there are strict ISCT standards on identifying mesenchymal stem cells, and no amniotic or cord tissue company has complied with these standards to show live and functional stem cells. And we've tested many of these products and found them to have dead cells. In addition, there's no FDA-approved amniotic or cord live stem cell therapy in a vial at this point. It doesn't exist. The tissues that Ben is being injected with are regulated to be dead cell products by the FDA. So next we hear the nurse saying that there are 6 million stem cells in this magical vial. The problem with that is that that's actually the total nucleated cell count of the product. Now they're dead cells, but that's the cell count. And there would just be a tiny percentage of those cells that would be stem cells. So again, we have a scenario here where this nurse doesn't know what he doesn't know. And the nurse states here that he's injecting the L2 nerve and saturating it. And then Ben says that rather than injecting the muscles, you really want to inject the nerve supply. So he believes he's getting the nerve injected. In fact, there is no blind injection technique without imaging guidance that would allow you to inject around the nerve from that approach. And if the nurse was really injecting a spinal nerve, which would be beyond the scope of that nurse's license, this is what it would look like. Obviously, we don't see anything like this in the room. And then the nurse says that these are stem cells that are thawed in minutes. The problem here is that stem cells that are frozen through cryopreservation have to be controlled rate thawed over hours and then placed in recovery culture for days to minimize cell death and damage due to thawing. The nurse then states that he's injecting these cells IV and they're going to find their way to all the damaged areas in Ben's body. The problem here is that based on the literature, 97% of those cells are going to be trapped in the lungs, and this is called the pulmonary first pass effect. And since these cells are dead, they may or may not get stuck in the lungs, but dead cells don't find damaged tissue. So the biohacker basically got biohacked, meaning that he thought all these things were happening, that he was getting live stem cells, that they were being injected precisely around the nerves, and all of that was bullshit. In this case, multiple people didn't know what it is they didn't know. So that's all, folks. If you want more information and you actually want to learn about this stuff, please subscribe to my videos, and we'll talk lots more in the future about stem cells and regenerative medicine. Thanks so much and have a great day.